there's a big buzz around the term biohacking and a lot of appetite for alternative measurements for your health. We wanted to bring this to you to give you proper information, debunk a lot of myths that we have in our industry, and bring you the truth about what biohacking is. Welcome, everybody, to the first edition of Beyond Biohacking Brothers, where I'm joined by my brother Miguel and my brother, or our brother from a different mother, Dr. Rudy Eberwein. And we are the owners of Medical Health Institute. And we wanted to put this podcast together for you guys because we know there's a big buzz around the term biohacking and a lot of appetite on for alternative measurements for your health. And so, you know, being that we own a clinic with thousands of patients where we've gathered a lot of data and actual practitioners who, you know, like Rudy Eberwein, who is a hospitalist by training, who can save your life and lives the lifestyle, we wanted to bring this to you to give you proper information, debunk a lot of myths that we have in our industry, and bring you the truth about what biohacking is.
Oh, and I think that by the time we're done in the next 6 months, you'll have more information about your body, mind, and health than you ever thought possible. And for you to become autonomous and understand that you could truly move the needle on your health and vitality just by making some real effective and practical changes. None of the fluff that you'll hear out there, but a combination and a collective unison of specific things that we'll recommend that will truly change your life. And we can literally guarantee it because we have literally a 95% satisfaction rate with our clients.
And we will put some fluff also. You know I like fluff.
Yeah,
Come on, man.
You like to invent words.
So, guys, I'm so excited that we're doing this because let's paint a picture for people listening to us, right? Biohacking, biohacker. When I went to med school in the 1990s, again, I'm going to date myself, right? The 90s, I went to med school. We did not know what biohacking was. Nobody used that word before. So what is biohacking, right? So biohacking is basically trying to hack your biology, meaning you try to use anything available to you to make your health better. To thrive. When you think about the way conventional medicine thinks about our relationship to health, none of this happens. Conventional medicine is very paternalistic. You go to the doctor gives you something, tells you don't talk, let me talk, a lot of gaslighting, take this medication, see you in 6 months. And that's the extent of healthcare. This generation, and this happened even more after COVID, where people now there's a lot more information available online. So now people can do their own research, can go and make their own decisions. Sometimes that research is wrong. That's what we're here to help them guide. But people want to take ownership of their own health. Biohacking, and that's what we like to do. I'd like to say I'm an MD, but that's my secondary mission. I'm a biohacker who happens to have an MD.
Yeah, and that's what I really, you know, your story is so compelling. You know, Dr. Rudy went to med school, he did the rounds, you know, went to the hospital, did his whole, you know, he paid his dues. And then at some point in his career, he was seeing so many diseases. And he just said, I want to prevent the stuff, right? Because a lot of this stuff is preventable, and all we're doing is treating disease after disease has already shown up. And, you know, the sort of the common denominator, at least that we see in our practice is, you know, one thing I could say for sure is that usually by the time disease shows up, you're usually 10 years too late, right? Like it's already been something that's been brewing. So our job is to really prevent those things from happening. And it's not just about taking medication or supplements. It's about, you know, a lifestyle that goes underneath it that can propel you forward to your goals. So what was really interesting about Dr. Rudy's career is that when he saw that, he made the very courageous decision to step outside of that realm of medicine because, you know, you had, I mean, security, right? Like you had the hospital, you had your paycheck, everything was good. You were a doctor, you had the accolades, and you said, I don't want to be here. I don't want to be treating these people. I want to prevent this stuff. And he went on his own, started his own practice with his lovely wife, Keisha, on weight loss. And then, by orchestra of the universe, Miguel met him about 8 years ago. We got together, and now we're here. So, and we're here to just deliver, like I said, truth, facts, data, and all of the stuff that goes underneath building a life of biohacking.
Yeah. And you know what I like with what we have, guys? We kind of have a little bit of what everybody's looking for, right? We have the different ages.
Yes.
30s,
We have
40s, the 40s, and the
40s with you and the 50s
zombie
with me,
age.
right?
Zombie age.
And I came as the adopted brother.
Yes.
No,
I
and the
love
same
this.
sizes. I'm small. There's a medium and there's a large.
So how amazing is it? Somebody listening to us, you'll find a little bit of everything that you want. Some people will identify more with you, Miguel.
Yeah.
Some people will identify with you, some with me, depending on where you are in life, your age. But our goal is to really be able to influence all of those other people and help them really not just survive, thrive.
Well,
that's the goal.
Yeah. And one thing that I wanted to echo on what you were saying about your past in traditional medicine is, I don't want to bash doctors, but from being in the medical field and suffering from ED at a very early age, it led me to search and find help. And I noticed that when I went to doctors, they wouldn't even look me in the face. They were just speaking to a little dragonfly, whatever it's called, that they just speak into a machine and it records. It's just something with dragon. The point is, the guy spoke into the machine, never looked at me, saw me for 10 minutes, walked out, wrote me a bunch of scripts, and that day I knew that I was on my own. Yeah. So the more I researched, I discovered that, and tell me if I'm wrong on this, it's not that doctors are doing anything wrong. It's just that you guys have spent so much time going to school and then read books that were pharmaceutically supported by pharmaceutical companies. And by the time you graduate, you were given a set of tools that are, for most doctors, the Bible. And what are the typical questions they ask you when you go to the doctor? Have you measured your blood pressure? Are you sleeping? Are you still taking your medications? Are you feeling dizzy? Do you have any chest pains? Right? But are they asking anything about your nutrition? Are you exercising? How's your sleep? How are your boners? Like, how's your overall health? Right? So we have to change the set of questions in order to get a different outcome. And the reason I say this is because the more we dug, the more I realized that the third leading cause of death in this country after cancer and cardiovascular disease is iatrogenic death, which for those of you that don't know what it is, it means death by doctor, either directly or indirectly via misdiagnosis, medical treatments, or healthcare interventions. So by default, trusting in our current healthcare model is neither safe nor reliable because it's a third leading cause of death. So this is where clinics like us come in. And one more detail. And average medical industry is about 17 years, they say all the way to 25 years behind what we're doing. So in order to be able to perform and do the practice the medicine the way you would like to, you had to become an out-of-pocket practice, or no?
Yeah. Well, and to echo it,
and guys, one thing I'm not going to do, I'm still a conventionally trained doctor. A lot of the podcasts out there, they badmouth doctors.
Yeah.
I will not do that.
Yeah,
here.
we won't either.
I will say that unfortunately conventional medicine gets so stuck into their cookbook medicine, into their, if you don't fit that box, it's not going to work for you. That what I've done, I'm conventionally trained, but I went outside the box. I'm listening to patients. Unfortunately, for a lot of doctors, my colleagues, I feel bad because sometimes, as a primary care doctor, you only have 15 minutes to see a patient. So in 15 minutes, no matter how great, and most doctors go in this because they want to help. And then you get completely destroyed by the system where you have to focus on a few things and you don't have the time. So really, like, our goal, and even with my colleagues, what I want to do with them is to really know, guys, there's another way to practice medicine.
Yeah.
That I know you love doing this. You're only doing it the wrong way because you're stuck in that that way. And for patients, people listening to this, I encourage people, don't take no for an answer. If you have a doctor or a provider that's treating you like this, doesn't look at you, is not listening to you, medical gaslighting is when you come with your own complaints. They tell you, no, it's in your mind. Do your research. And I tell people, fire your doctor if you need to. But, the doctors, unfortunately, are placed in a position where it's really hard for them to even see the bigger picture.
Yeah.
What I love when we go to those anti-aging conferences, you see more doctors now. You go to MMG now that we go all the time. There's thousands of doctors learning this.
Yeah.
So I'm optimistic about the state of medicine because I think more and more doctors, nurse practitioners are discovering this, and also because the demand is there. So when people demand better services, the doctors will have to do different.
And I want to make sure that I'm not bashing doctors
I
either.
know,
but
I know.
just
Because if you do, I'm going to bust your head.
I got it. You're going to stop prescribing.
and
and I don't want you to stop prescribing my meds.
And for clarity, I think he said it beautiful. Like, look, we're very proud and very lucky to have the system that we have. I mean, if you get shot or have a heart attack, you need to go to the hospital.
Exactly.
They will save your
Yes.
life.
You have
And
cancer,
we praise doctors for that who are on the front lines. They do an amazing job there. The problem is exactly what you said. I think that, I believe that 99% of doctors who go into this, they go in there with the right intentions. They want to help people, but then they get placed into this like system that almost rips the spirit of the healer out of them. And I think that's the cool thing. That's why I started with your career, because you had the perspective, right? Like, I don't know, it was obviously a calling where you saw that almost coming and you said, I don't want my healer to be ripped out of me. And so you moved on to your own practice, which is very courageous for a doctor to do once you're already in the hospital system, to step outside. And, the funny thing for all of you listeners, one of the things that I get greatest joy of, right? Because a lot of Rudy's friends would tell him, what a waste of talent. I can't believe that you're doing all this testosterone stuff. What are you doing? And now I would tell you 90% of those guys, I treat now. Like, we treat now. There are patients now, right? Yes. And so that's what's really kind of rewarding. But you saw that coming and you stepped out of that, and you were able to keep your essence of your healer and always learning. That's the one thing that I admire about you the most, is that you're always learning. You're humble enough to know, hey, this is not an area that I understand, but I know one thing. I'm a geek. I'm a nerd. I'm going to read it. I'm going to research it.
Yeah.
Well, one more detail on that, and we'll move on to another subject. But as you said, if you work in a hospital or you're a medical doctor that's insurance-based, the only way out, you tell me another way. The only way out is for you to start your own practice or something that's cash-based, because insurances, unfortunately, do not cover these treatments.
They don't.
And if they would, then I think the change would be much faster. But the fact that they don't, the doctor has a mortgage, he has kids, he has a life too, and he's worried about how to make ends meet. And to completely shift into creating your own practice takes a lot of will to do.
Yeah.
So,
and one thing that I'm encouraged by, functional medicine is now being adopted by different universities. University of Miami has a functional medicine branch. Mayo Clinic is really big at this. So again, I'm optimistic that this is becoming more. We're trailblazing that. There's no questions. For sure. For every provider
we're the tip of the spear, baby.
And guys, let's talk about something. Miguel, you started this, then I joined you. Then Carlos came and joined us. Like, tell us again, you were talking about ED that you had a young man and you could not find the proper way to help you. Tell us how you started this and tell us the history of MHI.
Right. So it's pretty simple, guys, and I'm going to make this short because we want to try to cover a lot of ground in these next 45 minutes. But I started experiencing ED-like symptoms or experiences at 18, and at 22, I had enough experiences to know and diagnose myself with erectile dysfunction. Knew there was definitely an issue, and I became completely codependent on using Viagra or Cialis or some form of erectile function medication in order to entertain myself, right? So that led me into a journey of nutrition. That led me into chiropractic. You remember I told you I thought it was a pinched nerve, or like I tried literally everything under the sun to help my AD, and nothing was working until I finally got my first blood work, and I looked at my testosterone, and I still remember there was LH, FSH, total testosterone, and sex hormone binding globulin. I had no idea what those numbers meant, but I had a sex hormone binding globulin of almost 100. I had a testosterone of 700, a low-free, regular LH and FSH. But my point is, I had, based on medical standards, normal numbers, but I wasn't getting the effects. So then, some way or the other, I ended up working at a TRT clinic. That led to the second TRT clinic. That led for me to open one. And then I met you a year later, which was like love at first sight.
Mm-hmm.
I remember.
Well, I think you left something out. I think you heard for the first time, you heard the word hormone replacement, and a light bulb.
Oh, yes. I remember I was kiteboarding. I was turning 24 years old. I was like, where am I going with my life? What am I going to do? I was a personal trainer. I really valued how I look and how I feel, and I didn't want to lose that. And I knew some way intuitively that I was going to lose that as I age. And I heard a friend of mine tell me, I have a friend with a testosterone clinic. Immediately, a light bulb went off. Literally, that was a Saturday. On a Tuesday, I was in the guy's office. I was already working for him. Oh. And that's how I just knew right away what I wanted to do in my life. And the word hormone replacement therapy for me it triggered the light bulb. It said it made sense for me. It was like, oh my God, this means chemical medicine. I'm going to be able to stay young for a lifetime. And here we are actually doing this. And really focusing to, I mean, we're cutting edge when it comes, not to toot our own horn, but I feel privileged.
Toot it, baby.
I feel privileged to have started something that I, literally out of my backyard, thinking it was just going to be something for survival, to seeing, every time we go to the conferences, who's who. It's not a big industry. And you realize that a lot of the owners and doctors are not there. So where are they? What are they doing, right? Yeah. And we know the Kobe Bryant, LeBron James, and Elvis Presley of the industry when it comes to hormones, peptides, and we've been trained by them, and we understand this. And where we're going personally with it is exciting. Exciting to understand that my whole thing now is, how do you live young for a lifetime? Right? So how do I stay looking phenomenal, but I don't expense my longevity in the process, which that'll be for another episode. Yeah. But how do you live to the last day healthy?
And I think that's a great, for all you listeners, this is, we like Miguel was saying, this was out of a personal need. We personally were always competitive athletes. I mean, we competed in sports since we were kids. So health, fitness, all that stuff was really important to us from the beginning. And now we're in a privileged position as a team to be able to use the science that we have available, right? Because in the last 50 years, we've had an immense growth to technology. And now we're able to leverage that technology with our lifestyles and, testing thousands of men and women reach their maximal potential. I think that anybody who's listening to this podcast, I think that's one of the greatest fears that we all share as human beings is, can I reach my potential? And what does that really mean, right? And so when you help somebody potentiate that, like reach their maximum level where they feel like they look, feel, perform, and are performing their best in every area that matters, you have a fulfilling life. And when we get to see that, it's such a privileged position to be able to be in this seat. And now we get to bring it to you guys, the listeners, and we bring you the real life stories with real life science.
Yeah,
no bullshit.
And really, we love what we do because we see those results. Like when we get those reviews or we talk to those guys and they tell you, oh my God, my life has changed. My physical strength, my physical energy, my mental energy, sexual energy, spiritual energy.
My career.
My God, this, my goal going into med school was always, I wanted to retire at 55. That's next year for me.
Wow.
I hope I have another 40 years doing what I'm doing, like not only for myself, but bringing it to patients. But listen, let's go back to what Miguel was saying. And there's so much to tease out of there because our average patient is suffering what Miguel has suffered.
Yeah.
We get a lot of patients calling us with symptoms of low testosterone. Low testosterone, feeling tired, low motivation, low energy, decreased drive, decreased sex drive, decreased libido, erectile dysfunction, getting fat, can get muscle, so many symptoms that again, I always like to say that when I went to med school, This, we were taught that this happens only to older men, late onset hypogonadism. What we're seeing in our society now, it's an epidemic of low testosterone in younger and younger men.
And women.
Those poor men and women also.
And
but
women.
but like those younger men, when they have this, they don't know who to turn to.
Yeah.
They go to the doctor, they get gaslit because the doctors not even expect a young man to have low T. When I went in med school in the 90s, they told us don't even check testosterone until the man is in his 50s or 60s. The paradigm has shifted. Then you talked about you suffered from ED. We just had an episode with the most famous
Elliot
doctor who has
Justin.
all the erection data in the world. Erections are becoming a big issue in our society.
40,000
Performance,
analyzed.
sexual performance is being an issue. Like maintaining your body composition, your physique. People want this now. So now there's a lot of
and by the way,
podcasts.
just to add, guys, for those of you that look great, doesn't mean that you have great function. I know that because I was fit since I was 16 years old, and you would have never expected that I would be suffering of ED, and it has nothing to do with what you look like. And it could be a silent suffering, agonistic experience that you're having that literally chips away at your mental function. And by the way, full disclosure,
He's good now.
I fully recovered it. I'm 38 years old,
Very important to
and based
say.
on Dr. Elliot Justin's scorecard on his erectile function firm app that you put this wearable device, I got 9.2 out of 10, baby.
Amazing.
But yeah, I didn't add about the testosterone. Finally, I got on testosterone therapy, and as we always say to our patients, there was my life before and there was my life after. I knew
How
right
old were
away
you?
I was 30 years old.
So-
I tried HCG, clomiphene. I tried a bunch of stimulants before, but it wasn't until I actually tried testosterone that my sexual appetite, but my energy, everything changed. And I was immediately addicted. And then it was, adjusting, adding a little microdose of daily Cialis. Then we figured out nitric oxide, acoustical sound wave, and now I'm like a combination of everything, but I respond perfectly fine now, right?
So Miguel is now almost our avatar. A 30-something
I would say this. He's our common avatar.
Like a 30-something-year-old
Yeah.
guy who's like noticing that he's not the same. 30 years old, you're still very young.
super
We
young.
did not, remember when we first started our practice, we said we would not treat
anyone under
anybody
30.
below 30
Yeah.
for low T. We changed that because unfortunately, we are confronted with all of those men who suffer true low testosterone. Like
and it
you.
happened super fast. It was we wouldn't treat anybody under 30, then it became 25, then it became 20, and it became 35. And this year alone,
18.
You had to make the horrible, very difficult decision, which I completely support, that, you had to put a teenager on testosterone because of his numbers were horrific and his
150s.
symptomatology was even worse.
And I think it's important to actually, let's talk about that. What's causing all of this, right? So most clinics that we know, and again, we're not here to bash anybody. We do want to change the model and like the stigma that's around testosterone therapy still, unfortunately, because there has been money-driven players in bodybuilding or ghost doctors running clinics, doing things sort of a pill mill. We're ethically doing this because we do it in our personal lives. But we figured out that, and we'll get into them shortly, but things from like endocrine disrupting chemicals. Now our doctor figured out iron overload from familial hemochromatosis, hormone imbalances, not just your testosterone therapy, especially for women. They can take 8 hormones to regulate a woman. Men taking 5-alpha reductive enzymes to protect their hair, causing the post-finasteride syndrome. We have our highly processed foods and all the toxins that are in our foods that we don't know how they're affecting our health. Then the top killers like cancer, cardiovascular disease, diabetes, metabolic syndrome, all of this combined is completely hurting our society. And then obviously illicit drugs and pornography for some guys. But overall, it's not just having low T, what is actually causing the low T in men.
Yeah. And I think that's a great point, right? Because when you tell a young guy or a young woman, right? Because it's both sides of the fence. There's either the young guy that has low T and has all these effects and has the numbers of an 80-year-old, and then you have the woman who, unfortunately, infertility is on the rise, right? So a woman that can't get pregnant, right? And so and it's such a disheartening news to the person when you tell them, hey, this is what's going on, this is why you're experiencing what you're experiencing. The very next question is why?
Yeah.
Why is this happening, and why is this happening to me? Right? And so that's kind of what we're here for, and we're going to set the tone for all you listeners to why are we seeing these hormone imbalances in our culture now, and why are we seeing it younger and younger and younger and younger?
And to add to that, it's no longer, guys or women, hey, just exercise every day, eat clean and sleep 8 hours a day. It just does not cut it. In today's toxic soup that we're swimming in, it just does not cut it. It's not just the medications and supplements you're taking, but your environment that you live in, from the lighting that you're being exposed to, from the radiation. I mean, it can get really geeky and overwhelming for people to know that it's not just a couple supplements, because this is what we love about the Beyond Biohacking Brothers. We're not about just red light, cold plunging, and some supplement. We're about the entire lifestyle, right? Yeah. And it's a living, breathing, moving thing. Yeah. And every year we discover something new, and it's
tweak it.
Biohacking is all about being able to track it. If you can't track it, you can't hack it. But what do you do with just hacking that you got a little more mitochondria from red light, or a little more cold shock proteins from cold plunging? Like, what about your hormones? What about your nutrients? What about your sleep? What about your erections? I mean, this is where the medical has been fused in with our lifestyles that makes us honestly totally different in that sense.
And fulfilled.
And fulfilled.
And again, we're almost done with this. So I think as our first podcast, what we really wanted to establish, first, our society really was seeing a level of disease that we've never seen
ever,
right? Not only are the number, the incidence of chronic disease going up, but you see a lot of people are not thriving, are not self-actualizing, are not being the best version of themselves. Yeah. So what we're going to try to bring in here is first, realize and talk about, let's be aware. Do a self-inquiry. How are you feeling in life? Are you satisfied? Number two, get data. Unless you check your numbers, and you don't just get like your basic blood test at the office, to your doctor's office, that is not adequate enough. Yep. Make sure you get real data. In our blood tests, we monitor what?
76. I know I actually have you noticed that we changed it?
No disrespect to the grandmothers, but you don't settle for grandma labs. Yeah. The kind of lab that they give, the kind of lab that they give my grandmother at the end of the year, and they tell her, oh, congratulations, you're not dying.
We're looking at 76 biomarkers.
76 biomarkers. So again, that's what I want everybody to listen to. Ask yourself, are you happy with how your life is? With your physical energy, mental energy, sexual energy?
Yep.
Whether you're happy or not, get data. If you're happy where you are, see what your levels are. If you're not happy, get data. Once you get the data, get it interpreted by somebody who has experience, a provider, a clinic who deals with this on a day-to-day basis and can give you real insights. And number three, you need a personalized plan, an actionable plan that you can do any kind of biohacking to improve those numbers and improve where you are in life.
Yeah, and the last two are super important. I think, the first one, get biological data and get enough of it. I think people understand that. But the interpretation of this number. I mean, I always like to tell people, I'm like, hey, it's kind of like reading the Bible. It really depends who's reading it, right? Because interpreting is a skill, and it's an art, right? It's an art and a science. And so get a practitioner who's going to look at it with completely different lenses, from an optimization perspective, not from the perspective of, oh, you don't have disease, you're okay, see you next year. It's, hey, you have these markers that are raising some red flags. How do we prevent this, right? And then the last one is, when you're talking about an actionable plan, I think, look, Michael Jordan needed a coach. And I think that unless you're a professional at this, and we're professionals and we have coaches, if you don't have a coach that can lead you while you're on this journey, then you're going to be in the woods by yourself. So it's not about just getting an actionable plan, but it's also because you don't have to work with us, but work with people who are going to be dedicated to your journey as you go along with it.
Completely.
Yeah, and I think it's also someone that we left out is symptoms, because if you just treat a piece of paper and numbers, if you just look at numbers, you're treating a piece of paper. And what we love about you is that you look at symptoms as well, right? My brother and I are literally identically biochemically, but symptomatology-wise, we're very different regarding symptoms and our results from certain therapies. So it's not only looking at the lab values, but being able to understand the person's lifestyle and understand the symptoms that are connected to what you're looking at, and how to set up a realistic plan that can be suitable for that person. Because for me, I might tell you I'm willing to do anything and balls to the walls, you might say, I'm willing to commit 2 days a week to exercising.
Right.
So what is that midpoint that somebody can effectively maintain this to have lifelong
and be consistent.
change?
Actually, that's one of my favorite parts about Doc, where people be like, "Oh, Doc, I'm concerned about my brother." It's like, who cares about the numbers? Tell me how you feel.
Yeah,
And then after they go into all this, then you're like, okay, now let's look at the numbers.
Yeah, exactly.
And if we go back to maybe your example, when you're saying the interpretation, you're a perfect example for this. When you started testosterone, as you were saying, your testosterone level was in the 700. So normal testosterone for our listeners is 300 to 1200. So at a regular doctor's office, they'll only do.
It's actually 900 now.
Yeah, it's
The top of the range now
no,
for
I know,
lab corp is
but
900.
like his
Back in the
level
day,
was
yeah.
700.
Back
Normal
in the days,
is
it was
300
higher,
to 1200. LabCorp in Quest now, the new numbers, the lower numbers 264,
Yes.
higher numbers 916.
Yes.
So meaning that you went to the doctor with a 700.
They told me I was
They'll tell
fine.
you, that's not it.
that's
not your
exactly what I
testosterone.
got. Oh, no,
They're like,
no,
you're
no.
doing great.
Nobody would touch them.
They don't really check an SHBG.
They didn't look at the free, and they didn't.
So SHBG, you always have that elevated that binds your total testosterone. So you have very little free testosterone available. So if you didn't have a doctor to really look deeply into this and interpret it the right way, you would have not gotten a solution to your problem.
Well, no, I became my own doctor. That's how I did it.
Back then, there was almost nobody.
I did enough research. I'm like, I need testosterone, and that's what changed it for me.
Yeah. So I think that we'll we've reached a time where we just wanted to kind of introduce what this podcast was going to be about. And like Miguel said earlier, one of the things that we can promise you is that if you stick with us, you will learn more about your physiology, your health, and your body than most doctors in the world. That part we can promise you because we have a doctor here with us. And you have two other guys who are living the lifestyle along with Dr. Rudy, who lives the lifestyle as well. And we put this stuff to the test. We put this stuff to practice every day in our life, and we put our money where our mouth is. So we are going to bring you the truth. We are going to give you real data, and hopefully we'll make this fun, right? Because we don't want to be talking heads. We don't want to be, we'll geek out a little bit, but we're going to make it fun so that you can come, by the time you're done listening to every podcast, you'll leave with an actionable plan, something that you can do today to affect your health, and new knowledge that can help you grow. So until next podcast, where we'll get into more details about the things that are afflicting us as a society and the why, we look forward to having you listen. And until then, stay healthy.
And God bless.
And God bless.
God bless.